interacting with the Abishirinku content, we are able to see that, and as I have mentioned, this content is actually heard on radio in 5 of the breakthrough actions, 4 of the breakthrough action states, and these are Bauchi, Kebbi, Sokoto, and the FCT. And over time, we can see that majority of the callers who call the 321 service to listen to the Abishirinku radio drama actually called from Bauchi State. And in 2020, we had over 48,000 number of callers who called the platform from Bauchi. And in 2021, we had over 33,000 number of individual callers who called the platform. And this is followed by the second most highest state, where we have, which is Sokoto, where we have individuals who also called from that state. And this is followed by Kebbi, and lastly, the FCT. Next slide, please. So there has been this has been a very good partnership with Airtel, where we have the 321 service. Breakthrough Action Nigeria has been able to partner with Airtel to be able to disseminate this kind of information through radio drama and KK games to the targeted beneficiaries. And there has been some value proposition between Airtel and the Breakthrough Action. For Airtel side, we can see that subscribers can enjoy at least 10 free calls in every month where they have to call 321. However, on their 11th call, they are charged 10 naira per call. Also, we have also been able to see that the content, the Abishirinku radio drama has gained so much popularity on the Airtel network, which has actually helped to promote the subscribers' growth. And lastly, other network subscribers are not left behind because they can also call the 321 service. However, they are to pay, this actually costs, or they are charged at a regular call rate. Then looking at the value proposition for Breakthrough Action Nigeria, Breakthrough Action content actually available across the 4 Breakthrough Action states. And although this content airs on radio, radio listeners can always call 321 to listen to this content. But we can see that over time, people who actually reside in other states are able to call the platform, the 321 platform, and are able to also listen to the Abishirinku radio drama, which means that the Abishirinku radio drama is gaining a lot of popularity. Also, individual callers can also call the platform, the 321 platform, at any time of the day to be able to listen to this content. And we can also see that from August 2019 to April 2022, all the Breakthrough Action content on the 321 service has resulted in a cost share of over 490,000 USD from Airtel. Next slide, please. So in terms of demand creation, different approaches have been used to promote the Abishirinku radio drama on the 321 platforms. And on the 321 platform, and this has been with the use of radio promotion in the 4 Breakthrough Action intervention states. There has also been the use of social media to promote this content on the 321 social media pages like Twitter, Instagram, Facebook, and YouTube. Also, the Breakthrough Action Nigeria community volunteers do have direct contact or engagement with their targeted beneficiaries to let them know that they can call 321 at any time to be able to listen to the Abishirinku radio drama for free. Over time, Airtel has been sending out SMS and calls to their subscribers to let them know that they can always call the 321 service to listen to health-related messages. And we conducted a survey on the 321 platform to understand what people or the 321 callers really like about the 321 Abishirinku radio drama. And we can see we have some very good quotes here. And I will just take some of them. The first one says that I would always like to call 321, but only to listen to the Abishirinku radio drama, which is really interesting. And then we have another quote here that says, I feel happy listening to 321 content, especially the Abishirinku radio drama. The information is educative and appreciated. And I'll take the last quote here that says, I listen to new episodes of Abishirinku. Anytime my friends meet to talk about the story, I am able to contribute and I feel happy about it. these are really good feedback that makes us know that the drama is really interesting. So we, in December 2021 and January 2022, we conducted a survey on the platform, on the 321 platform, to understand how 321 listeners actually heard about the 321 service. And we can see that this survey was conducted amongst 24,000 individual 321 users. And we can see that 51% of those who responded to the question, how did you hear about 321, mentioned that they heard about 321 on radio. And this can be attributed to the fact that the Breakthrough Action intervention states have actually been promoting the radio drama on different radio stations. We have 22%, 23% that goes to those who heard about the 321 via SMS and calls, which were sent to them by the Airtel network. And then we also have 8% that goes for Facebook and Instagram. And then we have 3% that goes for other means of them hearing 321. We also have those who mentioned that they heard about 321 on Twitter. 10% said they heard about 321 from a friend. And then we have 3% here that did not respond to the question. Next slide, please. Yeah, thank you very much. At this point, I will hand over back to Winnie to take us through the mobile curriculum. Thank you.
Okay, thanks very much, Glory. I want to engage us a little. So could you just, on the chat, just let me know if you want to conduct a training, what are some of the processes you have to go through? Bolade will help me look through the chat. Let's see some of the responses we're getting. So imagine that you're hosting a training. What are the processes involved? How do you bring together people? What do you do actually to have people come together for that training? Just in a minute, let's do that exercise. Okay. Okay, I've not seen the response yet. So how do you bring people together? What are the processes involved? Okay, so let me continue if there is no response. Next slide, please. So for our mobile curriculum, you just imagine when you have to bring people together for a training, you have to start thinking about the cost of bringing them together in terms of their accommodation, their transportation fare. You have to even give them traveling allowance. You have to also ensure that you accommodate some of them that are not close to the location of the training. Somebody just mentioned, Cecilia, that she has to develop the training materials. Exactly. So we have to make sure that everything is in place for that training to happen. You have to even get a hall, a training location. So just calculating all the cost, the cost involved in bringing together people for the training, you can see that we spend a lot of money trying to train people on different topics. So with the mobile curriculum, we create our content just as you do for your normal training. And then the difference is that this training is deployed through mobile phones. So you don't need to do any kind of you don't need to do any kind of.
Can you hold on a bit, Winnie? Can you hold on a bit,
yeah.
Winnie? I'm sure there is interference where you are. It's a lot of. But is it better now?
Yeah, it's better now. They were just passing and they were shouting. Sorry about that.
You can continue now.
Okay, great. So with the mobile curriculum, we deploy this training on mobile phones. So we don't need to get a hotel, and we don't need to get an accommodation for the participants. We don't need to accommodate them. We don't need to get a hall. We don't need to pay for their transport. All the costs will have to go down because all those ones are eliminated for the mobile curriculum. So with the mobile curriculum, we deploy them on mobile phones using either the interactive voice response or SMSs. And the processes involved as well has to do with content content development, just as Cecilia has mentioned earlier. So we develop the content that we're going to deploy to these participants. And then after deploying, developing the content, we do a pre-test with the intended participants. And for our pre-test, we do different kinds of pre-tests. So we pre-test internally to ensure that the contents are okay and our system is well set up. And for the participants, we just get a sample size of the participants who we want to deploy this content to, and then test with them, just to get their feedback to be sure that this content we're trying to deploy is actually clear enough and it's also okay. And once we get feedback from the pre-test, we use that feedback to finalize the content. And once that is done, we do a kind of orientation or sensitization to the participants. And what is involved in the sensitization is that we let them know the phone number that the training will be coming from, because a lot of times we notice that people don't pick calls from an unknown phone number. So we sensitize them to let them know the phone number the call will be coming from. We tell them the time we'll be sending out this training to them, and also we let them know the period it's going to take. So for example, we are deploying a training on to help providers. So we had to tell them all the training content, what they should expect, and also we let them give us a time that actually works for them. So we have a kind of a window period where this content will be going out to them. So some of them give us morning, some give us afternoon, and some also give us evening. So we ensure that we use that window period to send out the training to them. And also, once that orientation is completed, we deploy.
Winnie, sorry,
yes.
I want to make sure that our participants have the best experience. So when it seems a little bit loud in there, we'll probably want to pause a bit. But is it better now?
Yes, it's better. I'm at the health facility, so yeah. Okay. I'm so sorry about that. Yes. Okay, so during the sensitization as well, we encourage the participants to save our phone number so that whenever we call, they will know that we are the ones calling. So that also when they miss our calls, they can always flash for us to call back. So that was why we set up a callback feature for them to flash and then we call them back. For those that also miss a lesson, they can always flash the number to take their lesson. And at the end of the training, we do a mop-up to those that didn't complete the training. So we ensure that we send out the content again to those that miss out the training or started but did not complete at some point. We send the mop-up to them. Next slide, please. So this is the training guide that we've developed. If you look at the guide, you can see the phone numbers that the training call will be going out to. You can see the phone numbers included. We tell them what the message will be starting from. From this slide, you can see that it's starting from Albishirinku, and this is a BA Nigeria mobile curriculum. And we give them just the step on how to respond. They have to use their keypad to respond to some of the questions that will be asked during the training. And just as I mentioned earlier, we encourage them to save the number so that when we call next, they will know that we are the ones calling. Next slide. Yeah, so far we've sent out so many mobile curriculums to different categories of people. So ranging from integrated social behavioral change to providers behavior change, tuberculosis and COVID-19. So in 2021, we sent out integrated social behavior change to 5 states, to community volunteers in 5 states in Nigeria. And that was sent to 930 volunteers and community volunteers. But this time around, the database was updated to 1,700 community volunteers. And we also send out mobile curriculum to health providers. So we sent to over 5 states, and this was done in 2022, where we send this training content to over 1,200 health providers. For tuberculosis, the contents were sent to patent proprietary medicine vendors, and in 2021, it was sent to 156 PPMVs, while in 2022, we sent this content to over 10,000 PPMVs. For COVID-19, this was sent out in 2020, and then we sent out COVID-19 content to over 2,900 community volunteers across more than 10 states in Nigeria. Next slide, please. Yeah, so at this juncture, I will hand over to Raymond to take us through the mobile reminder and mobile survey. Thank you.
Thank you very much, Winnie. We're going to continue with the presentation, mobile reminders. At a point in time, normally we all have things to do and we need to be reminded on some of our tasks. Please, let's move on. So when it comes to mobile reminders as a product, it's basically to remind people on what to do next, especially when it comes to health. So under the BA Nigeria project, normally have enrollments at the community level by community volunteers. That data or contact is synchronized, and then they received mobile reminders. In that, when it comes to the mobile reminders, we ensure that they are reminded on the conditions that they have enrolled on. So currently, we're working with malaria, family planning. So people who have enrolled for the various conditions, they receive 8 mobile reminders. Now, there is an opportunity for client to opt out after the 30th message. So that gives them the opportunity to say, no, I wouldn't receive these messages again. And for us to verify whether people really visited the facilities that they were reminded to visit, normally we send a post-message survey 6 days after they were reminded to visit the health facilities. So they tell us, yes, I've been there, or I honored my visit. If you say no, we put you in a group, and then after 6 days, we resend, or we re-remind you again to visit the facility. Let's move on. Next slide, please. Now, so far, when it comes to patients referred by community volunteers, they continue to receive voice SBCC messages on what condition they are referred, as mentioned earlier. And so far, we have a pickup rate of 72%, and 16,908 patients listening to at least one SBCC messages. Here we are referring to the voice messages, and 7.7% of the client opted out after the 30th day. When it comes to referral follow-up messages, were also sent to patients if they attended their appointment. 12,819 patients were called with a 63 pickup rate. 1,796 patients either self or knows the client, and 53 of patients said they visited the health facility. This data from January 2021 to April 2022. Now, mobile reminders as a product has been deployed on the BA project. here we have 3 products under the mobile reminder. We can have mobile reminder using USSD.
Somalia, Botswana, Tanzania, Rwanda, and Nigeria.
And then using USSD, IVR, SMS, and then a chatbot. But for the BA program, we deployed the mobile service using IVR. Let's go on, please. Now, using the IVR as a tool for engaging people, either health service providers, community members, to give feedback on services that they have received. It gives timely access to data and also optimized response to needs. So on the BA project, we deployed 2 rounds of mobile survey to participants in Bauchi. The objective was to understand knowledge and belief when it comes to yellow fever. On the average, there was a positive change in knowledge of respondents who answered both baseline and end-line surveys. Next. Now, this is just to give a category of people that we participated or responded to the surveys. To put it in context, the round 1 survey was done in September 2021, and we had 592 people responded to it. After that, the survey, a need was identified, and then people over 2,000 CVs, PPMVs, general population, they received an intervention in the area of yellow fever through SMSs. So by April 2022, we did around 2 of the survey, more or less like the end line, where 1,111 people responded. Out of these, 500 of them responded to round 1 and round 2 surveys. Next slide, please. So these are the questions. I'll pick the first one. Was straightforward. Can you assess yellow fever from, can you get yellow fever from mosquito bites? Say yes. So you can see people who responded at the baseline and those who also responded at the end line, where we have plus 1.8 change in knowledge, attitude, and practice. Then when it comes to the second but last one question, yellow fever can be prevented by taking enough herbs and concoctions. The answer is no. Here we have 57.1% at baseline said no, and this reduced to 53.4% at what? End line. So here we have a negative 3.7%. Let's move on. The first one, it was looked at as a cross-sectional survey, meaning that people who had to respond to the various baseline and airline surveys were treated differently. So more or less, this slide showing is a longitudinal analysis where people who responded to baseline, and the end line, the 500 people. So here too, you can see the first question, you can get yellow fever from mosquito bite, 51.8% and 56.4%. And when it comes to last but one question, yellow fever can be prevented by taking enough herbs and concoctions, 57.2 and 51.0%, where we have negative 6.2. So basically, they say that yes, the interventions are working because we had plus 7.6% change in knowledge, but there are areas that we need to strengthen when it comes to yellow fever. Before I proceed, I would like to mention that each of these surveys were recorded in the various local languages. So people understood or could listen to it and responded to the questions using the language that they preferred. Let's move to the last. Okay. We've worked from 3-2-1 to mobile curriculum, to reminders, to mobile service on the BA project. What are the key lessons that we've learned? It's important to get a time that works for participants who receive calls. Though there is a feature for callback, it is very, very important to get higher participation to ensure that you engage them and sensitize them so that they give you the time that works for them before you send the calls to them. Voice content should not last more than 5 minutes to reduce fatigue and drop off. Yes. Apart from the survey, it is advisable that you have a voice or IVR or audio file that is less than 5 minutes. If not, people will drop off, though there is option to call back and continue from where they left off, but it will affect the participation and completion rate. For mobile curriculum or digital training, participants should complete a module before moving to the next lesson. Here, we're talking that, let's say you have a structured sort of lessons, maybe what is malaria, causes of malaria, prevention of malaria. It is ideal that people complete the first lesson before they move to the next lesson, to the third lesson, in that they'll have the flow of the information that you want them to hear. Proper orientation should be conducted before deploying digital health intervention to increase participation. This is key. First, because as Winnie and Glory mentioned, you're calling people with a number that maybe if they are not aware, they wouldn't pick. So we have to engage participants, let them know the number, the time of call, and also tell them that it is very important at any point in time, they can call back or flash the system, and then we'll call them back to listen to the content. Thank you for listening.
Okay. Thank you very much, Winnie, Glory, and Raymond. This has been very quick, and we're happy that we're keeping with the 1 hour schedule. However, we have a few questions, and I encourage everyone to also put their questions in the chat box if you have a question. But we'll start with the ones that are currently in the chat box, and you might also have the opportunity to just raise your hand and speak if you'd rather speak. But first, I think it's better to start from where we ended. Raymond, you have a question here from Ridwan Hassan from UNICEF. It says, do you also have a control group with which we can compare And also, did you survey the same group of people at baseline and headline? Raymond, I think that question is for you.
Yeah, thank you, Ridwan. For this particular survey, we didn't put in it wasn't more of the randomized trial, it was a straight surveys. But all we have done is to ensure that people who participated in or responded to the question round at the baseline also responded to the round 2 or the headline survey questions. And here the questions remain, they were all the same. There wasn't a change in the questions for us to do the comparisons. And someone also asked whether is there any reasons why your sample size for both baseline and headline were different?
Yes,
we were looking, sorry.
Please go ahead,
continue, please? Okay.
Yeah, please go ahead.
All right. We were looking at also measuring other metrics. That was why we opened it up a bit to see whether people who really had the intervention, that is the SMSs on the various health SMSs on yellow fever, whether they will be able to participate in other training. So that was why we opened it up a bit, just to see if the responses will come in. And you can see over 500 people responded to, in addition to the round 1 participant respondent, which gives us a positive indication that we can engage these respondents beyond the survey.
Okay, thank you, Raymond. It's still in the spirit of the survey. I think people are really interested in that survey. So what was the age range of participants surveyed? That's the question from Maureen.
Okay, we did not pick age range because there were other metrics that BA was looking at, which age was not really relevant. So we didn't pick the age range of the participants or the respondents.
Okay. I think there was a particular question for Winnie earlier, but before we get to that, okay, for Winnie, yes, I think I have that question now. It's about the number of community volunteers that were trained on COVID-19. I think that question is from Jamila. If Winnie is not there, can Glory or Raymond take that question?
Yeah, I think she's asking whether we can have a breakdown of the community volunteers trained. Yes.
Okay, Raymond,
yes, sorry.
Can you hear me? I think Glory was talking underneath as well, so I wanted one person to answer the question. So we are speaking to the audience, not from two angles. So Glory, do you want to take the question now?
Hi, Bolade. Sorry, can you repeat the question again?
Actually, it was Winnie. I thought it was Glory speaking. I knew I had a female voice. So Winnie, you can go ahead and take the question.
Yeah, I was saying that to respond to Jamila's question, we don't have a breakdown of the community volunteers per state, but we can also check that and share, but during the COVID training, the breakdown per state was not available. The database has been updated as at the time of the training.
Okay, Jamila, I don't know if that answers your question. Olukunle, I'll quickly answer you. Can we have access to the slide presentation? Yes, we'll share this recording with everyone that has registered for this brown bag, and the slides would be there. The only downside of that was that I started recording somewhat late into Glory's presentation, but we'll see what we can do if we can attach the slides as well. We would find a way to do that. Thank you very much for that question, Olukunle. So for the only person that put our expectation in the chat box, which is Ujunwa Omeokeke from Africa Practice. You said your expectation is that this session will provide you with the tools based on your experience to be able to engage the members of the communities. So let's hear from you if to some extent this session was able to provide you with any insight at all into this. You might want to unmute yourself if you're still on the call.
Hi, Bolade. Thank you. Thank you to every one of the speakers. It has actually been very insightful, and I'm hoping that we can be able to recreate some of these processes in terms of the mobile utilities and translating to local languages, because that was something we also realized is very relevant, that we have to be able to speak the languages of those people to be able to interact with them. So this was very useful to me, and I'll be looking forward to getting the slides as you mentioned. Thank you.
Okay, thank you very much. Yeah, so I sort of have one question, and I want to see if the person that I want to answer this question is still on the call. That is Justin De Normandie, who leads the social and behavior, is the innovation advisor for SBC in Breakthrough Action Nigeria. One question, Justin, are you on the call?
I'm here, yes.
Okay, so one question that I would want to ask for the benefit of all our participants today is that, is there a reason why we actually went with some of these approaches on the project? What was our thinking around it, and how did we land on some of these approaches?
I mean, it depends on, there's so many different ways that digital and mobile is being used by the project. So I think we first look at what are the needs of the project, and then we see what gaps is it that digital can fill, or perhaps complementing existing activities. For example, all of our community volunteers go through classroom training to make sure they have the skills to do their work, but for follow-on and refresher and ongoing training, mobile curriculum is an excellent way to complement the classroom training, because it can ensure that we can refresh their memory on aspects of their job or technical information. And it's something that we create the mobile curriculum, and then you can immediately send it out to 1,000 or 2,000 people instantaneously. So there's a scalability that you get with mobile and digital that you can't get elsewhere. Likewise, when we're doing these mobile curriculums, we can also get an immediate reading on whether or not people are learning from the class, or what are their current levels. For community volunteers, we see maybe a particular indicator is low and it's not improving. So that will help us with adaptive change management. It gives us an understanding of where we might need to focus. Again, for 321, it's another way to complement our existing media activities. Putting our radio program Al Bishirinku on 321 makes it so that people can call up and listen to an episode that they may have missed, or if they want to hear an episode again at any time, they can just call in. So long as they're an Airtel subscriber, they can call in and access that content for free to them. There's a paid line, but that's not as popular because people, it carries the same charges for any phone call. So less people are calling in to the paid line, but we're seeing outstanding numbers to the toll-free number. Likewise, we saw the excitement around 321 for Al Bashirinko, and that made us thinking about how do we expand that to other forms of infotainment. So the Kachichi games, which is the choose your own adventure style interactive voice response. That was something else that had been used in other country programs, and we've kind of, I don't know how many we've done now, at least we're developing them, one for Lassa fever. We've been doing, I think we've done at least 4 to accompany Al Bashirinko. We are, there's one in the pipeline for tuberculosis. So there's so many different applications that we can use with these, what we call KK games. The other one, the yellow fever, the mobile surveys is another way that we can get a really quick and dirty reading on a certain number of indicators. I mean, and it shouldn't be compared to the full in-person, person-to-person survey. It's a way to complement those types of things. It doesn't necessarily replace an activity on its own, but it's different ways that you can immediately at scale complement existing activities. And I think that's the power of mobile and digital under Breakthrough Action Nigeria. Then I don't know if I answered your question, if there's a follow-up.
Yeah, that's totally fine. And I think you did justice to what I really wanted to get out for the sake of participants. I have one last question for facilitators. And I think this might go to you, Raymond, or Glory, if you really want to take this. I think you can take it as well. But I just want like 2 key examples of how, because I see that we love feedbacks a lot. So we go back and ask them at baseline and at headline. Are there specific things? And then we add this 4 very key great lessons that we've learned on deploying these digital interventions. So I wanted us to give like 2 key examples of how we have used these feedbacks or learnings to sort of improve or adaptively manage the interventions. Are there specific things that we actually did based on some of this feedback that helped us to get better results? Raymond, Glory, any taker?
Hi, Bolade. So I can just answer to the 3-2-1 bit of it, and maybe Raymond can respond for the survey. For 3-2-1, it has been really interesting because we have had this kind of interviews, even when we went to the field to meet with those who are using 3-2-1 to ask them what their challenges are, and we were able to hear that they had some kind of user experience with using 3-2-1, which is really good for us. And one other very good feedback that we got was that some of them that we interviewed, we realized that they do not really speak English, right? They do not speak English. And this has really affected us over time because some of these messages we sent to them from the 3-2-1 platform to these end beneficiaries to let them know that they can always call 3-2-1 to listen to Abishirinko and all of that. It has always been in English. So imagine sending SMS to those who do not understand English in English language, and you expect them to read and be reminded that they can call to be able to access the platform. So with this, we had to change our approach. And the day we did this, sending them SMS as a reminder to call 3-2-1 in Hausa, we saw a very big spike on the platform, which is a really good feedback for us. Just let us know that these listeners understand and Hausa language more than English, right? And they can read it very well. So another part of it are the feedback that we have gotten recently from the field in terms of user experience, the user journey being long to accessing content and all of that. And these are what we are looking in house to see how we can better make the user experience good for the end users. Thank you.
Thank you very much, Glory. Raymond?
Yeah, thanks, Lani. For learning into design, I'll just refer to the baseline and the end line on this presentation, where after the baseline, we engaged and we had a feedback that yes, the timing of the calls were not favorable. So this time worked for them. When we sent a call, you could see, I mean, the next slide, you will see that the response rate moved from what? 592 to over 1,000. So when we realized that, yes, really, we implemented their suggestions and we had a result. That notwithstanding, we also had a feedback on the mobile curriculum where people or health volunteers and community volunteers, health service providers or community volunteers said, yes, it was lengthy. By the time they completed, it was almost 5 minutes. So we had to ensure that subsequent trainings were less than 5 minutes, and we had a good participation. So for feedback into design and every day, it's a continuous process, especially when we're looking at delivering good user experience to all participants on the BA project. Thank you.
Thank you so much, and thank you everyone for this robust participation. If there are no more questions from the participants, and we are all good with what we've heard today, I just want to announce that we will have a follow-on to this Brown Bag series, and we would have a session on our media interventions. That is looking at mass media, how we have leveraged partnerships and worked with media houses, private sector, and public sector to also improve community engagement. The date of that would be communicated to all of us, and we would we'll be happy to have you back again. That being said, we are just at 3 minutes to end of time, and I think we could all use for a break before we get into several other meetings. Thank you everyone for joining this meeting, and thank you to our presenters. Thank you to everyone who contributed. Thank you to everyone who participated. We will look forward to seeing you next time. We will send the recording of this and possibly the slides attached to all those who have registered. Thank you and have a wonderful day ahead.
All right, bye everyone.
Yeah, thanks and bye everyone. Nice presentation.
Yeah, bye everyone. Hello, everybody. Good afternoon, good morning to those of you joining from Baltimore or from the United States or from different parts of the world. I am Ramatu Ada Ochekliye, and I welcome you to this Brown Bag seminar, Leveraging Innovative Digital and Media Approaches for Community Engagement. This webinar is brought to you by Breakthrough Action Nigeria, the United States Agency for the International Development's flagship social behavior change project in Nigeria, which is implemented by the Johns Hopkins Center for Communication Programs. Today, we will share ideas on how Breakthrough Action Nigeria interfaces with media organizations through innovative approaches, partnerships, capacity building, planning, and compliance. We will also share some of the results from this approach. We will then open the conversation for questions, clarifications, and comments. As the session progresses, please type in your question in the chat box. Our speakers today are Eze and Shukra Bello. So a sort of rundown is we will be asking for a pre-webinar survey from everyone who is participating, and then we would have Eze's presentation, then we'll move to Shukra's presentation, have a post-webinar survey, and then we'll open the floor for questions and answers. So Eze is, he was trained as a theater artist at the University of Port Harcourt, majoring in dramaturgy. Before joining the Johns Hopkins Center for Communication Programs in 2015, Eze had many roles, including time as the artistic director of the Coltaf Theatre Troupe, funded by the British Council in Kano. He was a consultant creative director at the Abia State Council for Arts and Culture, a newspaper editor, radio and television drama producer at the Imo Broadcasting Corporation in Owerri, and in 2003, he worked with the Education Development Center in Washington on the Literacy Enhancement and Assistance Program funded by the USAID as the Formative Evaluation and Production Coordinator. Eze later worked for the BBC World Service Trust Nigeria, where he rose to the position of head of production. As a pioneer staff of the HC3 project that metamorphed into Breakthrough Action Nigeria, Eze set up the media unit and shaped its current direction of building partnerships and strengthening the media for sustainable development and communication. Our second speaker, Shukra Bello, is a marketing and communication specialist with over 6 years of experience in media strategy, buying, planning, and monitoring, and cutting across fast-moving consumer goods, banking, restaurant, not-for-profit, and transportation industries, amongst others. She has deep knowledge of content creation and marketing campaign development across traditional and online media. She has a master's degree in public relations and advertising from the University of Lagos and a digital marketing specialization from the University of Illinois in the United States. She works full-time as program officer, media and marketing for the USAID-funded Breakthrough Action Nigeria project and manages all media investments, including media relations and negotiations. Now, before we start the sessions proper, I would like to ask you to partake in the survey by clicking the answer that is most appropriate to the questions showing on your screen. So we'll give you 1 or 2 minutes so that you can respond to the questions. There are 2 questions that we want you to respond to. The first is, how important are media partnerships for social and behavior change? And the second is, do you know how media planning, buy-in, and compliance happens? So please click the most appropriate answer on your screen. Can you see the survey on your screen? We haven't received any responses yet.
I think it has not popped up. It is only Shukra's this thing that is on the screen. Bio that is on the screen.
I've responded already.
I've also responded also.
I think a couple of people have responded.
Thank you so much. It seems we may be having some problems. Okay, thank you so much. We may be having problems in the back end, but we would fix that so much. We're going to end the poll right now for those who have responded. Thank you so much. And then we'll move forward to the presentation by Eze. Are you ready, sir?
Yeah, sure, I am. Thank you.
Okay, thank you very much. And we'll begin right now.
Okay, thank you everyone and welcome once again to this webinar. As Ella introduced, my name is Eze. So let's begin by looking at the project goals and the intermediate results of the Breakthrough Action Nigeria. And of course, we already know that Breakthrough Action is the USAID's flagship social and behavior change project in Nigeria. And the project goal, of course, is to increase practice of priority individual health behaviors in maternal, newborn and child health plus nutrition, family planning / reproductive health, malaria, tuberculosis, and infectious diseases. What are the intermediate results expected? To improve individual and social determinants of health, strengthen SBC across USG investments, strengthen public sector systems for oversight and coordination of SBC at the national and subnational levels. That's pretty clear enough. So let's try to understand the Breakthrough Action Nigeria Media Partnership. And this partnership is structured to achieve the following. One, develop the thematic and technical capacity of producers of health-themed contents and journalists in partner media organizations. So building technical capacity is of a very top priority. Then improve the quality and quantity of health topics in those media organizations. Of course, when you improve their capacity, you expect improved content, both in quantity and also in quality. And then also to push Breakthrough Action Nigeria's thematic issues to the media front burner, and then provide media consumers, which is of course the ultimate goal, is to provide media consumers in BAN states with enough information to make informed decisions about their health. So it comes from building capacity, which results to improved quantity and quality of output, which results to constant mainstreaming of thematic areas. And then with the more information that media consumers get, the easier it is for them to make informed decisions about their health. And then, but for a better perspective, so the media unit meets the mass media needs of the BAN project. So that's what the media unit does. It also provides technical support to radio and television stations to record and broadcast health shows, as well as support journalists on the health beat to publish articles that speak to BAN's thematic areas. And why is this very important? It's important, because majorly and generally in Nigeria, health programs, are not too exciting for most media organizations because there's nothing structurally they consider exciting about it. It is not politics, it is not economy, and it is not social issues. So people don't really care, but with continual, building of provision of technical support, health programs becomes very exciting, and broadcast organizations are interested in those areas. So the media unit also provides a not paid for media platform to government partners, which include federal and state ministry of health and their agencies, to reach media consumers with targeted health messages. So a typical example of that would be, this is the month of March. We are celebrating World Tuberculosis Day. The media unit has also joined other partners to ensure that there were media appearances, so that you put technical people in the media and they're able to discuss issues around tuberculosis, same thing with World Malaria Day, same thing with World Nutrition Day, and so on and so forth. So the media unit also brings community voices, such as World Development Councils, religious and traditional leaders, women and community volunteers, etc., to the mainstream media through maybe vox pops, maybe testimonials, or during town hall meetings in communities. The media go in and record content from the town halls meeting and then bring it back to the mainstream media. Or they could do this through interviews and radio diaries, etc. So there are different formats and genre, that gives them the platform to be able to do this. The media unit supports media partners to either adapt sports produced by BAN or to make a fresh from the oven station specific sports that help listeners make informed decisions about their health. The sports are aired pro bono as corporate social responsibilities. So we're also beginning to notice a surge in radio stations, investing their resources to produce 30 seconds or 60 second spots on key health issues, and they are airing these pro bono. The media unit also builds partnership between BAN and media organizations. So apart from helping the mass media like radio, television, to develop content also produced by the media units, are also placed on the Airtel 421 platform. For people who don't understand this, Airtel is a telecommunication service provider in Nigeria, and they have a 421 platform that will put up content. And by typing in a code, by typing the 421 code, you follow voice prompt to navigate around the platform, and you are able to listen to a radio drama, to a sport, to a theme song, or an excerpt from already produced and broadcast radio magazine program. And the good thing is, anybody that has the Airtel SIM card, doesn't need to pay any money to listen to those contents also. And then the media units builds partnership between BAN and media organizations across project states. So it's not just HQ specific, it's across all the BAN projects states that you have these partnerships. And then the question then becomes, how are the media partners identified? So our social behavior change officers, well, for the social behavior change officers are usually our media interface in our project states. So what do? They help us to identify existing media stations. They reach out to the management and have a conversation about partnership discussions, about partnership and the key issues about benefits of partnership with the media organization, and basically capacity building, helping them to improve on their content, both quality and quantity, and which also makes having this conversation with the management makes it easier for us to mop up our cost share. And my colleague Shukra will be talking more about cost share in her own presentation. Then when the station is identified, the SBS officers then come through the station, do a recce of the content that they have to identify health content producers and reporters, that we can then begin to work with. But we have had a situation in most stations where they do not even have an existing health program. So in such a situation, BA Nigeria helps them to develop a cutting-edge health content that appeals to the audience. When these producers have been identified, we then set up the process of helping them to build their capacities. And in one of the ways we build capacities, there are numerous ways we build capacities of health producers, but one of them would be inviting them to, well, it used to be a quarterly review meetings, but now it's biannual review meetings. So it's now runs twice a year, where they are also able to interact with their colleagues from other media organizations, and they also listen to what their colleagues in other media organizations who already BA partners are doing, and this becomes a challenge to the new producers, and naturally it makes them to key into the partnership arrangement. And like we said earlier, BAN provides hands-on capacity building through one-on-one station-based mentorship. That is where the SBC officers walk into the stations to sit with the health content producers and mentor them. It could be in area of content research, in area of script writing, in area of interviewing, or even packaging their programs. We also have the biannual review meetings. That this is where we pull in all our media partners together under one roof, and do some form of capacity building. It's also an opportunity for peer review. Then we also had the thematic and technical training workshops to improve the skills of media partners in social and behavior change content creation. So then the question would be, in all these, what kind of results do we have so far? So far, supported health programs on partner stations now come in variety of formats and have integrated various elements that make them appealing and educative to the audience. I mean, prior to our intervention partnership with media organizations, most health programs usually come with such titles like radio doctor, for instance, where they bring in a medical doctor to sit inside the studio and they have this long interview, and most times they're all boring, full of technical jargons, but with the way we are working with them, they are able to make health contents a bit more sexy. If you understand what I mean, it becomes more exciting, for people to be able to tune in and listen. Government partners in intervention states provide guidance and themes like topics to be treated on the supported health programs based on their state's health needs. So what this means is that what BAN is also doing is to also build a bridge between the media and technical leads in the states and federal Ministry of Health and their agencies. So health producers don't just sit down in their studios and come up with program topics and go ahead and produce them. They work with the state team who help them to identify key health challenges that those programs need to address, and then working with the key technical people, they also serve as resource persons during the content productions. So BAN's drama skits, sports, and supported health programs are being aired on partner stations. And this is helping to improve health indices and outcomes in the intervention stage. So for instance, early ANC attendance, Penta 3, the MMP of course is the micronutrient powder, and vitamin A intake in Bauchi State rose by 2%, 4%, 22%, and 84% between July and December 2022. All partner stations now have one or more weekly programs. I mean, there are stations, and this is also a bit of a success because, for instance, you start working with one producer in one station, and his or her colleague begin to see the quality of the work the person is doing. They now have an idea to say, oh, I too want to make a health program. So we also begin to mentor such an individual to also develop new health programs. So what this means is that virtually all our media partners now have at least one health program that goes on air weekly, and in some stations more than one. And this has also helped to increase knowledge and practice of desired health behaviors amongst our audiences. And of course, the partnership with the media provides the project with the largest cost share volume. So for instance, the BN Media Partnership cost share tracker for Q2 2022, that between January and March, indicates that over 5,000 health programs / sports worth over 78 million naira were aired as complementary across over 50 stations in the intervention stage. So what that means is that the project didn't need to pay those 78 million naira to have those contents aired. So that's pretty good an achievement, if you ask me. So I can see for me, I consider this picture as a bridge to say to me that my presentation is over, but it's just a picture of technical people from the ministries that have been given platform to go to the media to discuss health issues. And I think this is where my own slides come to an end, and my colleague Shukura will be taking over from me to talk about media planning, buying, and compliance. Thank you.
Thank you, Eze, for that session. We learned how to identify media partners, build their capacity, and the amazing results that we have seen so far. To everyone who is participating, remember to type in your questions in the chat box as the session progresses. Next, we'll move to our second speaker, Shukra Bello, who will be looking at media planning, buying, and compliance, and looking at how our social marketing process is done from planning to execution. Shukra, you're next.
Thank you, Ramatu. Hello, everyone. I'll be taking us through media planning, buying, and compliance. And I'd like to start off by saying that this usually is a 360 approach. We start, mainly can be divided into three, and that goes from ideation to execution and then finally to measurement. But in terms of being more tactical, we start by doing a level research, then proceeding to negotiations, then purchasing of the media buy, verifications, then finally payment, and then evaluation. So media planning and buying cannot be managed effectively without a good media strategy. And a media strategy is a type of strategy that implements the use of a particular media or a mix of media to achieve advertising or marketing goals. And when you think of a media strategy, you should ask yourself why. Then that questions usually ties the marketing strategy with the project goals. And this also keeps the team focused on our big picture. So when we are creating a media strategy, we look at the target audience, the objectives of the campaign, emphasizing on awareness, either reach, is it the frequency, or are we trying to achieve an impact? Usually it is a combination of more objective, but the key for us is that it ties into the project goals. The intensity of the ads and frequency is also determined at the strategy level. The coverage, distribution, and the geography, are we focusing on the southwestern state or the southeastern state, or is it going to be a predominantly north-focused campaign? This question has to be asked and answered at the strategy level. We also determine the media mix at the strategy level. That is it going to be a radio campaign, a TV campaign, going to be on print magazine, or is it going to be digital? Even though digital marketing or digital intervention in BA is managed by a different team, it is necessary for us to understand what is being done at the digital level so we can synchronize our efforts on radio and TV to match that as well in order to get the best impact and best result for our campaigns. We also determine the type and place. This might be for some people an afterthought, but it's a very important thing to consider as a strategist. What time of the day would be the best touch point to reach our audience when they are likely to receive or digest our messages? It's not enough to just bombard them with, oh, take up malaria or take up FP. Are we reaching them at their most interested time? That is a question. So we look at the programs available on the radio station, we look at the time that's available, and we place and key in our spots at those key touch points to engage with our target audience. We also determine the launch and the flighting pattern. So for the launch of the campaign, we can also look at the milestones. Is there going to be a World Malaria Day or World Tuberculosis Day? Are there also going to be launches? For instance, there will be Shirinku launch. We can key in our campaign launch at the timing of these key events so that it can be better amplified and it can give us more leverage. And also in terms of flighting pattern, we have various flighting patterns which I will do a better explanation in the subsequent slides. Also, a very key determinant for us at the strategy level is our budget allocation. How much money do we have? How much resources? Like Ogaise mentioned previously, we have something called cost share. How much is going to be paid for by the project and how much is going to be managed by, going to be taken over by the radio stations themselves? All these are questions that needs to be answered. And also monitoring. Monitoring is something that needs to be determined at the conceptual level. How will the project ensure that whatever we set out to do is actually done by our media partners? This is what strategy helps us to understand. So why strategy focus on why, the question why, usually media plan is more around how do we intend to implement all these things that the strategy has helped us to identify. So typically a media plan is a document that shows where, when, how, and how often our ads will run to reach our audiences with those messages effectively. So I usually tell people jokingly that a media plan is a summary of all our efforts. And it will typically show the medium, the time and day of the placement, the daily distribution of our spots, the number of paid and complementary spots per station, the agreed rate and discount, this we need to get right all the time, and the total budget to run the campaign and the duration. So a media planner must understand that the marketing and the media landscape of a particular environment where they're executing, to know the right channel, the message, the right place to place the advert in order to achieve the high reach and other marketing objectives. So this is a summary of the media planning process. So we do something called the market research analysis, which involves target audience analysis, understanding their demographics, their age, their gender, type of experience, employment, things like that. And their psychographics, what appeals to them, you know, what kind of content do they enjoy watching? Is it entertainment? Is it sports content? You know, what kind of places or what kind of interests they have? So we do such analysis to know and understand very well what content we should leverage on and what content they are likely to make to use to connect with them. So for example, for tuberculosis, our target audience are male. So when we are looking at understanding that, even though we are trying to still capture some female audience, our focus can be around sports content, things, content of news related content, political discussions in the morning, things that, you know, are not mostly appealing to the male audience. And we also do typically during the market analysis, something called competitive research analysis, that is understanding what your competitors are doing and what kind of, how to leverage around what the competition is also doing. And also we establish the objectives. We do the media selection and the rationale. We do the budget allocation, message development, media scheduling, the measurement and evaluation. Next. So we have three different types of scheduling, well, three major types of scheduling pattern. There's continuous scheduling, which is mostly ads run steadily with little variation. So for BA, this is a method that we adopt maybe towards the end of the year, when we are just trying to do a more of a sustenance approach. Our media is not so high in intensity or too low in intensity. It just runs on a smooth level just to give us a presence, however, also making some impact as well. For flighting is leveraging periods that the advertising are alternated with periods that there are no advertising. So for example, if it's a, let's say an umbrella, you're trying to advertise an umbrella and you know for a fact that the rainy season will be the most appealing time to engage with your audience, you know, as a media planner, there's no point maybe running an ad during the sunny season. So the focus would be, even though some people use umbrella during the sunny season or the summer, it is not very common. So where your target audience are most likely to take action is when you are likely to do that campaign. So it saves cost and also gives you a better approach. Then pulsing, which is what we mostly adopt here in Breakthrough Action, is mixing both continuity and fighting strategy. So we have moments of high intensity, then moments where we balance through, and then moments where we go off air a little bit just for a break in broadcast. Next. After concluding on media planning, then we'll proceed, or in between that also proceed with the media buying. For us, timing is everything. It is better to be 3 hours too soon than a minute too late. So while planning is mainly, a summary of the plan in numbers, buying involves executing the media plan, which involves ads booking, scheduling with the stations. Ideally, buying starts at the negotiation level because that's at the timing where you determine, how much you pay your media partner and whether the amount being paid is the best price. So that is a very important question to ask. So at the buying level, the media plan, media purchase orders are sent out to the media partners and we schedule with the station, ensuring that our content is keyed in. So you can have a great media strategy and a great media plan, but when your media buying flops, your campaign does not work. Because at the end of the day, when you develop good media plans and strategy, but the station does not execute for whatever reason, either one, they didn't receive your MPO, that's the media purchase order, or two, they are aggrieved, maybe they have not been paid, or three, somebody did not log the campaign correctly at the station level, whatever the reasons might have been. If the campaign does not run, then whatever you have done at the beginning at the strategy has gone to waste. So for us, we buy either directly or through brokers using rates, passport, or bulk purchases just to get the best return on investment. And media buying extends beyond spot placement. You can have program appearances, sponsorships, time checks, co-productions, product integration. The options are, very big. So for BA, we focus on sports buying, but then we also do some program appearances, usually on a cost-shared basis. Afterwards, proceeding to the media compliance and monitoring, in Breakthrough Action Nigeria, media monitoring determines and assesses compliance. That is verifying planned versus actual, the effectiveness of our media buying. We are checking that the planned spots are properly executed by the station and it is in line with what we have done. Our process involves active and real-time monitoring of all channels. Whatever channel that we are placing our content, we have capacity to monitor. And high compliance usually means a high recall or conversion rate on our campaign. So if a media partner does not run and an audience doesn't receive the message, then they're not going to recall, and the social and behavioral change that we are trying to achieve at the end of the day is not going to be effective. So why do we need monitoring? The reason for monitoring is to ensure that the media plan is fully adhered to, or at least the station achieve a benchmark of 80% of compliance, so as to meet our campaign objectives. It also allows us to optimize our media plans as necessary, so makes us to be on our toes to make, decisions as the campaign goes on. So for instance, if a media house does not receive the MPO and monitoring captures that this media house is not running, we can easily plow back and make such decisions such that it doesn't affect the overall campaign. The compliance result is used to also determine how much that is owed to the station. So here, BA does not pay stations blindly. We use figures and data to determine how much is owed. So for example, if a station achieves 80% in compliance, then only 80% of the value of the spot will be paid as money to the station. It also allows the project to ensure a good return on investment and avoid wastage. So if the station, for example, we have instances where some station during the course of the month just goes off air for whatever reason, either due to electricity or mismanagement or things like that, and this is not reported to us. If we do not have capacity to monitor, at the end of the campaign, we are likely to have paid at 100%. So, and a return on investment, it helps us to monitor and ensure. And also on the side of the station, it helps them to improve. Because so many times, some stations are not even aware when things are not going well on their end. And BA has also played a focal role in helping them improve the standard of their operations. Knowing that they have to meet these benchmarks has forced many of the stations, even encouraged them rather, to be at the best and also operate optimally. And it also allows them to meet, allows us to meet our own KPIs and also the station's KPIs. So in the recent year spanning 2020 to 2021, Retroaction Nigeria has garnered across 82,320 free complimentary spots, estimated at value of $679,802. Also on TV, 11 stations have also contributed 2,040 spots, estimated at $109,180. So the result shows that, you know, as much as we are trying to run campaigns, it also shows the station's level of commitment and also the adaptiveness of our vision as a project. So at the end of the day, it shows good partnership. Impact on exposure. So from the baseline data from 2017, many of our campaigns were below exposure level 40%, but we have seen some tremendous growth over the years, with media making a paramount contribution to this. Albi Shirinko in the last omnibus achieved 90% in exposure. Jide Kaiji, though a new campaign, achieved 40%. Malaria 80%, family planning 79%, Lassa fever 80%, TB 74%, COVID-19 74%, yellow fever 62%. So overall, our exposure level across all thematic areas are very, very much impressive. Okay, I'll hand over to my colleague Ogaize for the challenges. Thank you.
All right, thank you, Shukura. So frequent challenges, changes in leadership in media houses across the states, it's actually a major challenge. So a typical example would be like, you started a partnership conversation, with a management team, and then before you know it, the head of station is moved, or is retired, or is relieved of his position, or is transferred. And then you notice that you start that conversation probably all over again. This is in some of the stations. Maintaining an average compliance across all the states and the campaigns, and Shukura has actually hinted about it. And some of those challenges with compliance could be as a result of power outage from the broadcast station, or maybe from especially government-owned stations. When somebody from the government has just makes a phone call, and the time belt that your content and your campaign is supposed to run is taken off for a political activity, or like during the Ramadan fast in northern Nigeria, when most of other programs are taken off the air and only religious programs are able to make it. So that way it becomes difficult to maintain compliance. And with our partner stations, so most of them, there's been a challenge of making them to provide documentations that we need. So for instance, a cost share. But one thing I've also found, one way we have found to navigate around that is to make sure you collate your cost share documentation during those biannual review meetings. So that way it has also been a bit easier. And some stations, some media partners are still insisting on payment for supported health programs. And this is quite expected, because number one, they need finances to be able to run the station. This is also because most of them power their station with diesel, as most stations are not even hooked up to the national grid. So, and the cost of running the stations continue to increase. So most people want to be paid. They are not too much interested in corporate social responsibilities, and of course, some stations, are also ask for advance payment, before they are able to, to enable them run your campaign. But of course, as DA Nigeria, we also cannot pay in advance. we have to pay as per campaign that is run, if it is through paid content. So these are some of the challenges, that we have also had, but we have also constantly finding a way to navigate around it. Thank you, Shukra. You want to talk about lessons then? Over.
Okay, so our media engagement strategy is a pathway on the journey to self-reliance, and skills are locally domiciled in the stations. So all the skills, all the support that the social and behavioral change officers have given to the stations at the state level, at the end of the day, it is part of them and it's domiciled at the station level. And one of our other lessons would be that the contents that we have developed belong to the states, because the State Ministry of Health and its agencies work with the media to develop those contents. So BA does not work by itself only, but work in partnership with all necessary parties. So these are some of the pictures that shows how we do station visits, and also some of the presentations around our training of monitoring media monitors in Breakthrough Action Nigeria. Thank you.
Thank you, Shukra, for your presentation, and Ms. Eze for closing that out. We learned in this second section the media planning, buying, and compliance. We also learned why developing media strategies is important, the media planning process, and why monitoring various aspects of the media partnership is necessary. We'll begin to take your questions shortly. If you would prefer to type them in the comment section, in the chat box, that's fine. If you would like to ask your question directly, please raise your hands up. But before we take your questions, I'd like to crave your indulgence to see if we can try the poll one more time. I would launch it for 1 minute and see if you are able to respond to it. So can you please confirm that you can see the poll?
Yes.
Yes.
Okay, so we'll let it run for 1 minute. Unfortunately, I think this is a back-end problem. It's still not showing anything. So I'll just end it. I just wanted to try it again and be sure that it was not working. Okay, yes, but it's not reading. The results are not showing here. So we'll just end the poll and go into your questions. So I'm looking through the chat box to see if there are any questions so far, and I haven't seen any yet. Okay, Yusuf Ibrahim asked if media is an approach or a unit, and there was some response to, okay, Dr. Tito said it was both. Shukra and Mr. Eze, is there anything else you'd like to add to this? Shukra?
Sorry, please ask that question again. My network just had a glitch.
Yusuf asked if the media unit is a unit or an approach, if media in Breakthrough Action Nigeria is a unit or an approach.
It is both a unit and also an approach. The media the media unit is both a unit in the Breakthrough Action and also an approach that we are able to reach our intended audiences. So there's also a unit in the Breakthrough Action that focuses on interfacing with the media and producing the media content. That's the media unit. And of course, we use the media approach to be able to reach to our intended audiences within the communities. Thank you.
Thank you very much. Ana Luisa asked that, can you share your experience reaching the lowest levels of audience? We're facing in Guatemala many Shukra, would you like to respond to Ana Luisa?
So I thank you, Anna, for that question. So you're asking if you can share our experience reaching the lowest level of audience. So you are facing, sorry, the keeps moving. So how do we reach the lowest level of audience? I think for us, the key thing is to first of all, make sure that we are able to develop an appealing content, because once you have a content that your audiences can relate with, they want to listen to that content. That is one. Two is to identify media stations, that audience, listen to. Of course, a typical example would be in Nigeria, for instance, a station like Wazobia FM, for instance, appeals to a certain demography, which would be the type of demography you are talking about, and a station, for instance, like maybe Hot FM will be a station that appeals mostly to people in the urban area. So the key priority for us will be to first of all identify the media that we think is mostly consumed by our
Mr. Eze, we sort of lost connection to you. Can anyone else hear Mr. Eze?
Sorry, it happened again. So sorry. So I was saying that, your question is how you are able to reach. The thing just popped out again. The question is, can we share our experience on reaching the lowest levels of audiences? And I was trying to explain, that for us, there are two key things you need to consider. First and foremost is, what medium do you want to reach them with? So for us, majorly is radio. And in radio, I know that several different radio stations have different audience that they cater their interest to. So for instance, in Nigeria, a station like Wazobia FM, for instance, will appeal majorly to people of such demography that you described as the lowest levels of audience, if I understand it clearly. So you need to identify such channel, because that's the channel they majorly listen to. And then also in creating your content, you need to put them into consideration. So for instance, when we do programs and use different formats like testimonials, if you want to get testimonials, it's also important that you reach to those type of audiences and get content from those type of audiences, because the good thing that everybody wants to listen to people that look like them in the media. That's just basically that. And in creating the content, make sure it's a content that actually should appeal to them. That way, you should be able to, to reach to them. Although one challenge with mass media is that you cannot force it onto anybody. So it has to be appealing first. It has to grow organically, So in summary, make sure that you are using the right channel that your intended audience listens to, and make sure that your content is suitable and speaks to them directly. Over.
Thank you, Mr. Eze, for that question. Imrana Mohammed Arzika says he joined late, he or she joined late, and yes, we would share the presentation with everyone who has registered and participated in this webinar. Olubumi Olofa says, Shukra, can you explain more on the phases of media scheduling pattern? Shukra, do you want me to go back to that slide?
Okay, but yeah, thanks for that question. I think basically the summary would be that when you are developing a media campaign, you need to tie it to key events, or you need to know when you want to launch the campaign. And then afterwards, you need to determine how you want to run it. So in scheduling, you can have a continuous scheduling where you just go, you maintain the same. So every day you run 4 spots steady. There's no variations. Everything just goes steadily. It's called a continuous scheduling. So you're not trying to go high at one level or go low at the other level. Sometimes this approach works, but it is not the best approach. However, when you do something like a flighting pattern, you are off air at a specific period, and then you are on air at a specific period. So for instance, for breakthrough action, we can decide to come on air. For example, our Wish Wrinkle, which is typically a 3-month campaign. So at the end of the 3 months, we can decide to go off air for a bit of time and then kick off the next season. So that's a flighting pattern. However, if pulsing strategy combines both flighting and continuous, where you are going at a pulsing level at a certain time, and then you go low, and then you go high, and then it's like a wave. So the purpose of that basically is you are not off air completely at any particular time. But BA does like a combination of it, and we can go off air for a short while, but typically we start maybe at the beginning at a high weighting, then drop off for a while. It also helps with budgeting and other. So that's the summary. And then I was going to mention that for a media plan to be successful, or a campaign generally, whether it's a paid campaign or a cost share based campaign, the first thing that you need to do is research. Like if you do not do research, it is likely to fail. Like there's no way to mince the words. There's no better way to say it. Like it would likely fail. A successful campaign is on the premise of research. And research doesn't have to be something big, like hiring a research agency to give you insights data on consumer patterns or things like that. It's taking little results. For BA, we have so many historical data that we can decide not to leave our offices and just leverage on what we have learned over time about our audiences to build our new campaigns. But at the beginning, we did a lot of research to understand the market penetration, the audience penetration, what kind of radio do they listen to, or in a particular location. So for example, reach is important. Like, does this radio cover this particular geography? But also impact or affinity, like you say, is very important. So even though this radio station covers this location, does your audience have affinity to that radio station? So a good example would be maybe in Plateau State. PRTV might have like overall reach across the entire state. But then when you are going to a particular location, like maybe Shandam, a more appealing radio station would be Agro FM. So those kind of low-level research might seem like little decisions you're making. But at the end of the day, it is paramount, especially when you don't have, and in media, you always do not have enough money to spend. So you have to make a decision as to what media house will give you the best results that you're trying to. And then with media, it's also about objective. Be objective, like no feelings. Look at the data beside in front of you. Do some local market intelligence, because it's not just about numbers. Okay, even though this station is rating high, but what does the local intelligence say? Combine that and make decisions, and that will give you the best result. And this is linking back to Anna's question as well. Thank you.
Thank you so much, Shukra, for the questions. We are at time, and as such, we cannot take any further questions. We'd like to thank you for joining in today, and we'll send the recording of this session to everyone who registered and participated in this webinar. We'd also like to use this opportunity to announce a webinar that is coming up on March 28th. It's titled Resources for Community Health Workers, Strengthening Counseling Through an Empathetic Experience of Care. So Breakthrough Action Nigeria and USAID Advancing Nutrition will bring this to you on March 28th at 1 p.m. West African time and 8 a.m. Eastern time. It will feature Dr. Shitu Abdul-Aguye and Angela Samba from Breakthrough Action Nigeria and Andrew Cunningham from the USAID Advancing Nutrition Project. Thank you so much for joining us, and we look forward to seeing you on this other webinar. Have a great day, everyone.